This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. From irregular bleeding to cancer, many women face gynecologic health issues at some point in their lives. Finding the right care at the right time can make all the difference. Here to share their new program at Providence Cancer Institute, we welcome Dr. Christopher Darus. Good morning, doctor. How are you?
Good morning, Helen. How are you?
Good. So tell me about your specialty, because it's gynecologic oncologist, right?
Yes, indeed.
And what does that cover?
So we are specialists in the diagnosis and management of reproductive tract cancers in women. So this includes cancers of the uterus, of the ovaries and fallopian tubes, the cervix, rare cancers of the vagina, and vulvar skin as well.
Why don't we hear about these kinds of cancers more often than we do?
That's a great question, and I really appreciate your helping us bring more awareness. You know, this year, there will be about 110,000 women in the U.S. diagnosed with gynecologic cancers, and about 32,000 women will succumb to these cancers. So we really would like to raise awareness. You know, these are below the belt cancers in women, so some people aren't comfortable talking about them. But it's really important that we get the word out about these things.
What are the risks? Like, how are you at risk of getting it?
So the most common gynecologic cancer is cancer of the uterus, and it's actually the lining of the uterus called the endometrium. And this is usually caused by excess estrogen, actually, which causes the lining to grow. And nowadays, that's most commonly caused from obesity, actually. And we've seen an increase in this particular cancer over the last 20 years that's grown along with the obesity crisis in the U.S. When we look at cervical cancer and some vaginal and vulvar cancers, those are almost, those are typically caused by human papillomavirus, or, HPV, that we've heard a lot about. And then ovarian cancer and fallopian tube cancer, about 15% is actually hereditary and often goes along with breast cancer. You think of Angelina Jolie, for example. Right.
So what are some warning signs that would say that we would need to go to the doctor?
Well, I think one that is really important is in women, especially postmenopausal women. Any bleeding in postmenopausal women is not normal and should be evaluated, even tiny. Okay. It doesn't always mean there's cancer, but it means that it should be evaluated. And in younger women, abnormal bleeding as well should be evaluated.
Okay. And treatments, what kind of treatments do you see, and have they changed over the last few years?
Yeah, so we do a lot of multimodality treatments, meaning surgery, chemotherapy, targeted therapies. And I think the big advances over the last 10 to 15 years have been that we're doing more minimally invasive surgery, meaning that instead of having a very large incision to, take care of these things, a lot of the times, especially with cancers of the uterus, we're able to do, 4 or 5 small incisions, and the patient can go home the same day typically, or the next morning, and get back to their normal life much more quickly.
Oh, that's great.
And there's also advances in treatment, particularly in targeted therapies, and these are treatments that are designed to target alterations on the cancer cell itself. And certainly immunotherapy is very exciting, and of course Providence Cancer Institute is a leader in immunotherapy. This is treatment that teaches your immune system to attack the cancer.
Right. It's incredible what's going on. So we talked about obesity, and I'm assuming that you want to avoid smoking and drinking. What are some other lifestyle choices that could put you at risk?
So, certainly it's important to maintain a healthy diet, and exercise is very important, particularly to prevent uterine cancers. So Pap screening is the most effective technique to prevent cervical cancers. And this is why we see in countries like the U.S., our rates of cervical cancer have gone way down. We now have a very effective HPV vaccine that I think is going to be a big game changer for cervical cancer in the world, frankly. And then in women with a family history of some of these cancers, it's really important to talk to your doctor about this and get tested.
All right, doctor, thank you so much. We'd like to let you know that if you'd like to find out more about the Gynecologic Cancer Program, just give them a call at 503-215-2075. We'll put that on our website at KATU.com. Dr. Darus, thank you so much.
Thank you very much, Helen.
You're welcome. All right, we'll be right back with more AM Northwest. Don't go away.